people come to our office for a variety of reasons, and I think for most of us we associate those with a pain or a condition or something that needs to be treated, and that's often the case. However, there is a population of patients that we see and take care of on a very regular basis that some people may not think about, and that is pregnant ladies. During pregnancy, there can be a lot of pain and discomfort and conditions that respond wonderfully to chiropractic care. And for some of you, you may be saying, oh, I don't know how I would have made it through my pregnancy without my adjustments. Some of you may be saying, wow, I didn't realize you could go to the chiropractor when you were pregnant. So I'd like to just address a few of those different issues. One, during pregnancy, it's very common for women to experience an increase in back pain or neck pain or headaches, even some sciatic nerve trouble, numbness, tingling into the fingers and hands. And there are many reasons for that. We're retaining more water. During pregnancy, a woman's gait changes dramatically. We know that to maintain their center of gravity as their belly and the baby get larger, their stance will become a little wider. They'll toe out a little bit. Their belly will push forward, but in order not to tip forward, they'll push their head forward and have a pregnancy gait, which we've all seen. And that can create increased stress on the low back. That can create increased stress on the neck and the shoulders at the base of the skull and lead to a lot of symptoms or uncomfortable conditions that, you don't need to be any more uncomfortable than necessary during pregnancy. We work with a lot of OB offices in our community that refer to us and make sure that we're working together to provide effective care. And during pregnancy is a very common time for ladies to be very conscious of what they're putting into their body. And they realize that a lot of medications are just simply contraindicated when they're pregnant, or they're doing the best they can to create a very healthy environment for their pregnancy, and they don't want to put in any unnecessary medications. So chiropractic care is completely safe during pregnancy. We have postgraduate training in taking care of women during pregnancy. I'm certified in the Webster technique, which is a pelvic balancing technique that is used during pregnancy and can be used outside of pregnancy, but most commonly people reference it there. So if you would like more research based on this, you can go to the ICPA's website, which is the International Chiropractic Pediatric Association, or it's ICPA4Kids.com, I believe, or chiroforkids.com. If you look up the ICPA and Google it, you'll find it there. And one other thing that I would like to show you is that many women really enjoy this about coming into the office, because when you're pregnant and as the pregnancy progresses, often laying on your belly is not really an option. But all of the tables in our office have drop away belly pieces or abdominal pieces, and so I'm going to show you that on this table. So there's a lever that we can release, and this portion drops down, and we can drop this portion down to make room for the belly, and it works very effectively to allow women to lay on their belly and receive the adjustment. There are different techniques that we employ and modify. So if you are pregnant, if you know someone who's pregnant, or if you are wondering if chiropractic care is safe and effective, it is very safe and effective. We have research showing that the duration of labor is shorter whenever women can keep their pelvis aligned and keep the musculature relaxed and the ligaments relaxed, so that the body is allowed to go through natural childbirth easier. If you have more questions on the topic, feel free to message us, email us, talk to us on your next visit. So hopefully this is useful information for you. Have a fabulous day. We'll see you for your next adjustment.